Here talking about all kinds of stuff today. Today is March 5th, 2021. We are about a year into this pandemic, and even though we keep saying that we're going to stop talking about the pandemic and talk about other things, there are always questions about that. And this week, I really didn't have much I was going to talk about, so I asked for comments to ask questions, and I did get one that asked about COVID vaccines, being around friends, family, and infants and masks. So we will cover that today. I'll also talk a little bit about the upcoming pollen season because it is March, and some fun office updates. So I have a handy dandy little sheet of paper. So if I'm looking away, it's to check that. Um, First and foremost, I do want to cover vaccines because the COVID vaccines we're all super excited about. I wrote about when I was able to get my vaccine. It was my early Christmas present. Super excited about that. I was so unprepared for the overwhelming emotion that came with getting it. It was just such a relief after working for nearly a year in the situation where I know I could be exposed at any given time, and I didn't really have an opportunity to stay home like some people did. It was kind of scary. I'm relatively low risk given my age and background, and I do have asthma, but that has not been shown to be a COVID risk. We didn't know that at the beginning, though. So, it's been a hard year for all of us, and I'm excited to see there's light at the end of the tunnel, but we're not there yet. I really, really, really want people to not let down their guard. I know that spring break is coming up, and people are going to want to do fun things with their friends and family. But I very much encourage people to just wait a little bit longer. The more this virus spreads, the more chance we have of seeing variants. And we don't know what these variants will do, what they will be, if the vaccines that we have currently developed will be as effective against future variants. So the more we can contain the spread now, the better the vaccines and everything else will work, and then we can get back to normal. And the United States is projected now to have enough vaccines available by the end of May for all adults who want it. So it's not that much longer. We can have a fun summer if we just stay home a little bit now, wear our masks, be cautious, be smart. It will take the community to do this. So even though I've had both my vaccines, I am theoretically immune at this point. And I actually donated blood and got my titers, so I know that I have antibodies. Don't know exactly how much they will protect or how long they will last, but I know they were there when I at least donated. But even with that, I am still wearing my mask whenever I'm outside my house. If I potentially am going to be around other people, I will wear my mask because I want to show people that I care about others, and they don't know necessarily if I'm walking into the store if I've had a vaccine or not. So please, even once you have the vaccine at this point, until we have sufficient numbers of people who are vaccinated to have that herd immunity, everyone should still be wearing their mask for your own protection as well as everybody else's. That being said, I did a lot of reading about transmission of the virus after vaccination, and it is really encouraging. This is like a week too soon because next week there is supposed to be the CDC is going to put some guidelines about transmission and after vaccine status, who can be around other people, and things like that. So we're about a week away from having some official guidance, but there is a lot of encouraging research that is showing that the vaccines not only keep us out of the hospital, which is what the original studies were designed. Will it prevent severe infection with COVID? That was shown, and the mRNA vaccines had over 90% effectiveness, which is amazing. The newer vaccine, the Johnson and Johnson one that's coming out, has lesser effectiveness reported, but you have to remember that the mRNA trials were done before a lot of these variants came out, and the J&J was done with those variants out. So we're not comparing apples to apples there. You have to look at the data. They're all very effective. And if you have the opportunity to get a vaccine, get whatever one is recommended for you or available for you. Don't wait to try to do a different vaccine because you heard that one's better. All of them are very effective. All of them are very good. There are benefits to the single dose J&J one that's just coming out. Even though the numbers don't look quite as good, we can give them out twice as fast because it's only one dose. So super, super excited about that. It also is easier to store. It doesn't have to be kept at the refrigerated temperatures, especially the Moderna, which is very difficult to store. It's much more stable than the mRNA vaccines are. So if you have the opportunity to get a vaccine, don't even ask which kind it is. Just sign up, say yes, donate your arm, get the shot. It is a good thing. On our website, on the news page, there is a page if you were interested in your kids being in one of the vaccine trials. Children's Mercy, as well as another group, are enlisting students or children of various ages. So if you're interested in that, signing up from the links on our website do not guarantee that they will be accepted into a study or that you will have to do the study if you are offered it, but it at least shows your interest and then you can get more information. All right, so some of this growing body of evidence that I've been alluding to just a few minutes ago mostly involves the mRNA vaccines. I have not found a whole lot with the J&J, but that hasn't been out in the real world as long. So anything we do as scientists and physicians, we have to be able to assess the data. We have to have sufficient numbers to be able to make generalizations. So a lot of this stuff, it's not like people have been holding back. It's that we just haven't been able to study it yet. But the mRNA vaccines have been out long enough now and sufficient number of people have been vaccinated. They have started doing trials where they swab the nose of people who are vaccinated. And it's really, really encouraging, guys. I mean, to the point where now that I am vaccinated, both my parents have been vaccinated. I've got like one more week to wait until their like time is to the maximum benefit. And then I'm going to see them and I'm going to give them a big hug because I have not seen them since a year ago to give them a big hug. So the studies are showing that when people are vaccinated, not only are they going to stay out of the hospital, with 95% certainty, but if they are exposed, they're very unlikely to get COVID, even asymptomatic infections. And if they do get an asymptomatic infection, the viral load is so low that chances are they're not going to share it with anybody else. So if you have two people that have been vaccinated, they can hang out unmasked and not really worry about it. Now, this is not official yet. This is still, next week, next Thursday, the CDC is supposed to actually say something official on this. But that is what I'm hoping for, and that's what the data is really showing. So I am excited about that. There have been studies in the UK and Israel and some other places that have really shown this, and consistent across the board. Again, for the mRNA vaccines, but we're hopeful that the J&J ones will be similar. So another question kind of tacked in with the vaccine question is about masks and babies. Interestingly enough, I saw a report not too long ago that studied infants down to 4 months of age can safely wear a mask. Now, the CDC recommendation is still kids over 2, and different school districts have different recommendations. Some daycares require them, some only require them after 5 or whatever age they set it at. We still think kids don't share as much, but with some of these new variants, some kids do share with their families. So anytime I'm seeing a kid that is sick, whether they have COVID or not COVID, parents don't want to get sick because then they have to take care of a baby and they're not feeling great. So parents can wear masks. And if the family is going to a place that has lots of people, maybe you have to take your baby to the store because you don't have anyone to watch them, letting them wear a mask, as long as you can watch them, there's really no reason that they should not. Make sure the mask is comfortable and make sure they're not playing with it, because if they're messing with it, even adults need training on how to wear masks. We've been doing this for a year, guys. Don't touch your face. Don't touch your mask. I see people all the time grabbing the mask and pulling it up, and dirty fingers put the germs right where your nose is going to be inhaling it. So I'm a huge proponent of washing your hands before you touch your mask, to put it on, to take it off, to move it if it moves. I was doing a circumcision this morning, doing hospital rounds, and every time I looked down, my mask would go up. So I feel like I have a tick or something because I'm moving my neck to try to move my mask because I couldn't touch my mask. But that's kind of what you have to do. Open your mouth or look up or down to try to get that mask to move if you can't wash your hands easily from where you are. But try as hard as you can not to touch that mask. And that goes for, like, if you're in the car, I see people taking it off and throwing it on the seat and then putting it back, or people taking it off, putting it in their pocket, then putting it back on. The more times it's touched, the more surfaces it touches, the more chance that it's contaminated, then you're putting it right on your face. So I really encourage you guys to watch what you're doing with your masks. And if you take it off, have a place that you can put it, like a plastic container or a paper bag, cardboard box, something that's clean that you can lay your mask in and then replace it safely on your face. So I do think if you are with your babies and you want them to wear a mask, it is probably safe because studies have shown down to 4 months of age that it can be worn safely. Um, the next thing I wanted to talk about was allergies because it is March and that's what we see this time of year. I will say, even with my horrible allergies that I always tell people, I at least do an antihistamine and a nose spray, and then I wash my nose at bedtime and oftentimes in the morning again to get the pollen out. Um, Even with my bad allergies last spring, my allergies were nowhere near what they usually are. Now, granted, I wasn't outside much, but even in the morning driving to work, usually my eyes would tear or I'd sneeze a couple times. If I wore my mask, it didn't happen. So I encourage people when you're outside, if you have allergies, wear your mask, but still get your medicine going. If you have just allergies, use your over the counter medications as needed. If you also have asthma, this is a good time of year to make sure you're scheduled for your routine asthma checks. The guidelines are to have an asthma check every 3 to 6 months. So I generally recommend at least spring and fall to have an allergy asthma check to make sure all your asthma medicines are where they need to be. If you need to change your daily administration of medications, it's a good time to discuss the action plan with your physician. So if you have not scheduled your asthma check, definitely get that on the books because March and sometime in the fall, great times to do it. Other than that, some exciting things coming up in Pediatric Partners world. Most of you are aware that we are building a new building. The Olathe office will not be affected, but our Overland Park location is moving just like a block away. So basically, the still same drive, but it will be our own building. So we are really excited to be able to literally build it from the ground up this time. One of the things that we are going to do for decorating it is to have artwork from all of our patients displayed. So if your kids from, finger painting toddler age all the way through college level artists, any of our patients who like to do art, whether it is painting, drawing, or even photography, if they would like to do something that will be presented in our office, we are going to rotate things through as we receive them. So if your kids are interested in doing that, or if you think that your kids would be interested in doing that, watch for information on that. I'll post it on our social media sites as well as our newsletters. And if you're not signed up for our newsletter, go to our website, pediatricpartnerskc.com. There's a newsletter sign up right there. Just put your email in. It is really important, especially in this day and age where things can change all the time really rapidly. Facebook is not really good all the time at sharing everything. You will see some of the stuff that's get posted, but not everybody sees everything. So if you really want to know what's going on, get our newsletter and you can sign up for it right from our website. One of the things that we are promoting now is our quarterly themes. This quarter's themes have been healthy body. So basically eating healthy, exercise, and sleep. So this month we are really focusing on exercise because in the spring we can go outside, we can ride bikes, we can play with friends, we can do things safely outside. Still keep your distance, don't get into big crowds of people, but we really are encouraging getting out and about. Watch for more new quarterly theme coming soon, and that will be in our next newsletter as well. So I don't see any comments or questions, and I hope this was helpful. I hope this will give all of you guys a reason to want to get the COVID vaccine when you're able to get it, because it really, really will help us all be able to hug our friends and family again with confidence. It will take everybody being vaccinated for all of us to be able to remove our masks all the time. But while we are in that building phase of building that herd immunity, if both people have had vaccines, you can fairly confidently say they can get together without worrying about it. So small groups where everybody has been vaccinated, that would be okay. So that will be a reason to get vaccinated. And that hasn't been publicly stated yet because we have to gather all the data and be confident that the numbers show that we can do that safely. But I am fairly confident that the numbers will show that. So It's not official yet, so there's still that like little warning. But I know for my own personal family, we are going to get together and I'm going to give my parents a big hug. So I hope you guys can all do that too soon. And I do think that the vaccines are going to start getting put out faster and faster now that there are 3 companies that have them available. I do not see any questions. So with that, if you have any questions that pop up, feel free to put them in the comments. And I hope that you are safe and have a great weekend. Do something fun outside. Thanks. Bye bye.